Good afternoon. Welcome to Advocacy Insights for June 2025, where NEHA's Government Affairs program gives you an update. What's going on in the country and across the nation regarding environmental health policy and insights. I'm going to begin this program with sharing my screen and letting you see some of what I am seeing out there. And if you'll notice, I am calling this month Whiplash. There's a lot of reason why we're doing that. Environmental health, the federal government has been going from one direction to another, back and forth, and it's really caused a lot of confusion out there at both the federal level, the local level, and at my level about what is actually moving forward, what can we expect. But we can at least move forward with where we know where we are right now. And if you're wondering, Hedora is the smog monster. And so what we're talking about is we're out there just like Godzilla, struggling every day to fight the smog monster, fight environmental threats out there. And we're having less and less, we're having less and less direction from the federal government. Let's try this. As I've often said, environmental health is primarily state and local. It's funded by state and 90% from state and local taxes. Federal government provides very important efforts, but it's the local environmental health that's very important that makes things happen. The day-to-day, body art, food safety, recreational waters, cannabis, it's all done at the state and local level. So that means that we continue on, no matter what the federal government does and what we're seeing and hearing from Congress or the administration, we still move on. But when we have things that occur at the federal level and new directions occur, that really throws you off and it makes it very difficult to predict which way to go. Now, with environmental health, what is going on? Well, Health and Human Services has decided to come up with a new program. They have a new vision for environmental health. This is actually could be positive for us. Very few administrations, if any administrations, have never discussed environmental health. This is the first administration that has ever actually mentioned the term and acknowledged that the environment has an impact on our health and has tried to make a proactive effort. However, that's what they say, and this is what they're doing. What Robert Kennedy has said within Health and Human Services is that he wants to create a division of environmental health under the Administration for Healthy America. That's going to mean he wants to combine ATSDR, NIOSH, NIEHS, and everything that's left at the CDC's National Center for Environmental Health put into this one agency to address environmental health. What does that mean? That is really what we're going to be trying to figure out in the next coming months. What has recently happened? DOGE came in. The Department of Government Efficiency, they came in with a hatchet. They weren't very delicate, but they came in on April 1st and eliminated almost all programs and almost all staff from CDC's National Center for Environmental Health, the Division of Environmental Health and Scientific Practices. All the things that we're doing, study, research, understanding, response to environmental health out there, they eliminated all those jobs. And those jobs are supposed to go away on June 2nd. We've been past few months wondering what was going to happen. The staff from the National Center for Environmental Health stayed home. They did not work. And they were all waiting to be let go on June 2nd. Well, right before then, federal judge said no. The DOGE does not have the authority and they should not be firing everybody on June 2nd. You got to wait until a few things play out. And then what happened was a week later, HHS reinstated the Department of Environmental Health and Scientific Practice workforce on June 11th. So that's what I mean by whiplash. At the beginning of the month, I had planned to talk about one thing. By the middle of the month, it has shifted dramatically. So as of today, we have a CDC, National Center for Environmental Health. There is no office or administration for Healthy America. There is no division of environmental health within the administration for Healthy America. So it's we don't really know where things stand. And as I was talking with Congress yesterday, they were being very straightforward. And this is from the appropriations staff, from the majority appropriations staff. They said, well, this can't happen without congressional authority, which means HHS needs Congress to say, yes, we need to create an administration for Healthy America that includes the Division of Environmental Health. Now, this does not mean that the administration can't do things within their own power. Will they be able to move ATSDR over to a different program? Will they be able to bring them all together? There's probably some authorities that they have to do that. But to simply create a brand new division and a brand new administration is going to require Congress. And so therefore, we should really plan on, at least in the near future, assuming that there'll be a National Center for Environmental Health, at least into the next fiscal year. But there should be more on that we're going to have to know about. Where are we at there? There we go. The agencies under the AHA Division of Environmental Health. This is what the administration, the Trump administration, proposed to Congress last week. That ATSCR, National Center for Environmental Health, NIOSH, and NEHS would all be combined within an environmental health division, which is going to cover 800, which would be 826 million total. That's a severe cut on each one of these programs. And what they said within that document is that in the AHA Division of Environmental Health will protect against environmental health risks by studying the effects of environmental factors on human health. The way they want to do that is having funding at the following levels. They want to continue the Safe Water Program at 8.6 million, which is where it's been since at least 2023. The CLIP program, Childhood Lead Poisoning Prevention Program, keep that level funded at 51 million. The Lead Exposure Registry, keep that funded at 5 million. They want to continue mining research, 66.5 million. The Firefighter Registry for Cancer at 5.5 million. The National Mesothelioma Registry, 1.2 million. I'm going to go skip the next one, but go on to NIEHS, provide 994 million for the main program, for the Superfund supplement, 51.8 million, and also include in there the Energy Employees Occupational Illness Program at 50 million. Every one of those programs I've listed are between 5 to 10% less than it was under the Biden program. They've cut each one of those programs or level funded it. So we're not seeing a great increase that's going to allow them, that's really going to point to something that says, yes, we're going to be able to address environmental health risks and study the effects. The one exception, World Trade Center environmental health programs. That's gone from about $500 to $600 million to $913 million. The one program that the Trump administration wants to increase. It is these are what the administration is proposing to Congress. Congress is going to go through the process of review and trying to figure out how much they want to fund everything. And they will come up, and between the Senate and the House, they will determine how much money they want to give to all these programs. They're going to make a determination where they want to create a division of environmental health. They're going to make a determination of how environmental health will look at the federal level in the coming year. Now, that being said, what we have heard from Congress is that this is very premature, and Congress isn't ready to go down that path. Let me finish a few things out. The Trump administration is recommending the following programs be completely eliminated: the ALS registry, all funding for climate and health; Trevor's Law, the tracking and investigation of suspected cancer clusters; the Environmental Health Outcome Tracking Network. And if you remember, that was a huge project that was born about 20 years ago. That has been a significant part of the CDC's National Center for Environmental Health. And they also want to get rid of asthma. These are the programs that they are going forward saying would like to get rid of them. What this means is that the administration does not have the opportunity, does not have the ability to go ahead and eliminate these programs in and of themselves. It is up to Congress. Congress has to agree to this or not. Now, like I said, we were talking to the appropriators yesterday. Majority staff, minority staff, they both told me the same thing, which is they are not planning on having a budget done by the end of September in time for fiscal year 26. Right now, Congress is worked up on the big, beautiful bill, the Trump agenda. They're going to have to go through reconciliation to try to get that thing through. They want the whole program done. This has not given them any time to go in and review the budgets for all these programs. Now, the Trump administration has given them what they would like to see funding, but it's really up to Congress to do that. What this means is that the efforts that we've taken, that other sister associations have taken, that the state policymakers have taken, that the governors have taken, that local officials have taken to comment on these programs, to say how they will support, help, whatnot. Every time we make those comments, it helps. Apparently, it got back to the administration that environmental health was important, and they reinstated the Division of Environmental Health and Scientific Practices. This is a phenomenal shift. It proves that environmental health has value. We have clout. We can make things change. And that's the positive side, but we still have a long way to go. What are we looking for on food? Well, let's take a look at the Human Foods Program. It was basically untouched or very limited. Their impact was very limited compared to what CDC saw under DOGE. Now, the Human Foods Program there is going to keep their Office of Microbiological Food Safety. They're keeping their Office of Food Chemical Safety, Dietary Supplements and Innovation, keeping the National Center for Excellence. But they too did suffer. They went through a reduction in force. There's less people there. And mostly it's because of retirements. People who were able to retire took the early buyout. So there are great plans for this office. The Robert F. Kennedy's HHS has great plans for this office to do a lot to make America healthy again. However, they're going to have to do it with less staff and less resources, which, as we've known, it's very difficult for them to do. They are also trying to implement the policy recommendations found by the Reagan-Udall report that came out in 2024. And they want to still move forward with that reorganization. That's going to be a challenge because they're going to go under this reorganization with less funding and less people to do it. We will see how far they are able to get. Next slide I want to talk to you about is this one. Where is public funding going? Well, if you can see under the Trump administration, they're doing substantive cuts, eliminations, or moving over to AHA under their current programs. What they would like to do is move, as we said, several programs over to AHA, which we see here, birth defects. ATFCR is being recommended to be moved, part of environmental health, part of the injury center. A lot of it, they're planning to eliminate. 91 million out of environmental health, 290 million out of OSHA, occupational safety and health. Global health, moving half of that. These are all programs that they are trying to eliminate, trying to realign to save money and to make government more efficient. However, like we said, by doing this, it doesn't give the agency much ability to do much, to have much authority to rearrange things, to try to implement the goals of the new administration, which is, like I said, to use environmental health, make it data-driven, and to make it more efficient and streamlined. What the administration has said over and over, though, environmental health is critical. It's not like we have seen this in the past, and mind you, it's been done by both administrations, by both Democratic and Republican administration. A few years ago, under a Democratic administration, we saw the zeroing out of the lead program. We have seen zeroing out of very important programs from both Democrats and Republicans. The difference this time is the administration has been very forthcoming in saying environmental health is critical to health, and that we need to change the way we're doing and operating and thinking about environmental health if we want to get this country healthy again. That is very welcome news for us. But then they're going about it by doing some dramatic cuts, which is very sad news for us. What is going on with Congress right now? Well, we're still in the budget reconciliation. What has to happen here, and there's a reason why they're going down this path. If they do reconciliation, they can pass the Trump agenda without getting 60 votes in Congress, in the Senate. They have nowhere near that. They barely have 50 votes in the Senate, and they need to have that in order to get the Trump agenda passed. Now, they were able to get something passed of the Trump agenda through the House. That's where it should have began. It did. They came forward with saying, this is what we want to do, and that they want to, and then they gave it over to the Senate. Now that the Senate has it, the Senate had the option of either agreeing with what the House said or making changes. The Senate makes changes, this program, it means it has to go back to the House, and they have to agree on the language changes. It passed the House on a very tight margin, 1 vote majority. It's going to take only that 1 vote, 1 congressman to say, no, I don't want to do this. I don't agree with the changes that are going to Medicaid, changes going to Medicare, that it's not addressing the deficit, that it's not addressing the salt taxes on on in states that have income taxes. It's not addressing border security enough. Anything can come down. You lose one vote in the House, the bill's done for. Senate knows that. They're quite aware of that. So they want to be able to address things, come to conclusions, and come forward with a policy that will really that will answer everything in both the House and the Senate. Now, here's stuff that goes beyond environmental health. This has nothing to do with the appropriation. This simply has to do with the Trump agenda. And to get it through, they're using budget reconciliation, so they have to couch everything in terms of the budget. This is changes to the budget. Well, that means you can't have policy writers. You can't say, we are going to create an agency for environmental health or division of environmental health, because it has nothing to do with the budget. We're going to create Make America Healthy Again division, because it has nothing to do with the budget. It can only be dealing with budgetary issues, which is the way they've couched it. Also means they can't deal with Social Security. That means they cannot eliminate taxes on Social Security, which is one of the things that Trump wanted to do. But this process will not allow them to go forward. They can provide funding for the border wall, but they can't say that we are going to implement policies to change immigration in this country. That's going to have to go through the 60-member full Senate and the House. The parliamentarian has not commented on this, and there's still an enormous amount of disagreement in the Senate, not to mention disagreement in the House that they're going to have to reconcile before they get this through. Senate has taken a recess for Juneteenth. They will be back in session next week. They wanted to get things passed and over to the House and on the president's desk by July 4th. As many have said, that's very ambitious for them to get done, but that's their goal at this point. They're working on it. It's about the best we can say. For environmental health, there's no major provisions here, but it is holding up any sort of appropriations for fiscal year 26, any sort of action that may occur on environmental health, any sort of bills on environmental health. As I note here, Congress has passed no bills related to environmental health in 2025. If we move on, what have we seen in the state legislatures? As of June 2025, which means between January and now, the 50 state legislatures have enacted 159 bills related to environmental health. Nothing in Congress, 159 bills. That's the reason I have the Texas legislature here under construction. It shows that the legislature works even when the state house is under construction. They move forward. When environmental health, these are the number of bills I've been able to track. 72 bills on environmental health, 21 have been enacted. Food safety, 372 bills have been introduced. 70 have been enacted. Regarding body art, we've seen 101 bills introduced. 27 of them have been enacted. Climate change, something that the Trump administration wants to eliminate. We've seen 54 bills. 12 have been enacted. Means climate change, even if Congress eliminates all climate change at the federal level, will still occur at the states. Drinking water, 182 bills, 23 have been enacted. Water, wastewater, 35 bills, 6 have been enacted. So, like I said, we're only halfway through the year. As of June, 159 bills have been adopted relating to environmental health. Now, as we go on in Advocacy Insights in the coming months, I'm going to go over food safety. I'm going to go over body art, climate change, water, drinking water in the coming months. Today, I'm going to deal with environmental health. What have we seen regarding environmental health in general in 2025? Well, one of the interesting ones that we see, at least on behalf of NEHA, is that California introduced 1288. Now, it hasn't passed yet, but mind you, California's in a year-round legislature. They're not going to adjourn until December of 2026. So we got plenty of time to get this bill through. And it's fascinating because they want to make sure to have the REHS, NEHA's REHF part of the one of the requirements, or at least one of the elements that are going to be required for environmental health professionals in the state. We, at one time, 38 states required the NEHA REHS. We're down to about 24. Many of them have pulled away for a variety of reasons. But to see California come back, that's very heartening. We're very happy to see that. Louisiana, Senate Bill 195 passed. This is a very interesting bill because it specifically talks about the city of New Orleans. When the city of New Orleans, due to a lack of city-employed staff, can't provide sanitation services within the French Quarter, the district may procure its own emergency contract to ensure continuation of services. The other caveat with that I didn't add in here is that once they get that posted up, once they get the contract into place, they can charge the city of New Orleans for reimbursement for that contract. So it basically takes the authority away unless the city has staff available to address with sanitation within the French Quarter. Kind of a harsh way for the legislature to respond, but it does acknowledge that environmental health sanitation is absolutely critical for the French Quarter within New Orleans. Montana introduced and enacted several bills this year dealing with all aspects of environmental health, including cottage foods, fees, different activity. The one I'm highlighting here, and I put under environmental health, is House Bill 853, which uniformly raised fees for licensed establishments, which means for retail foods, wholesale foods, a long list of things, but they were acknowledging that the current fee structure wasn't sustaining the staff and the resources that they need at the local environmental health level, or even at the state level, to provide these services that they need to retail foods and wholesale foods. So they've increased those fees. I'm sure there is going to be somebody from Montana who will call me up and say they're still inadequate. They probably are, but it is an acknowledgement, and the bill did pass that it allows for increasing fees. North Dakota, this is really a cosmetology and aesthetics board bill. It creates a cosmetology board. It creates licensing, and it relates to making sure that they have licensure, meaning reciprocity licensure, meaning if you are licensed in another state, you can come into North Dakota and get be automatically licensed to engage in cosmetology or in aesthetics. It's a very broad-based bill, but it really transformed cosmetology within the state and body art within the state. Nevada, Senate Bill 466. This was interesting. It transfers the authority from the Board of Health to deal with sanitary protection and water and food supplies, meaning environmental health, from the Department of Health over to the Department of Agriculture. Not too sure if this is supported by the Nevada Environmental Health Association or they opposed it, but it's a pretty severe change to practice within the state, moving that broad of a programmatic activities of environmental health over to the Department of Agriculture. Many states do have the Department of Agriculture addressing both manufactured food and retail food. This is not unique, but it does but it does make a statement that they feel more comfortable, the legislature feels more comfortable, that the Department of Agriculture handles water and food supplies. Texas, Senate Resolution 173, recognizing Make Texans Healthy Again Day. The reason I wanted to highlight that one was that's very universal across the nation. I think I've been tracking around 20 bills out there across the 50 states that are saying we need to address Make America Healthy Again. We need to pull food dyes out of school. We need to pull certain chemicals out of school. We need to change policy, food safety policy, to not allow processed foods into the marketplace. Now, very few of them have passed. Texas did recognize Make Texans Healthy Again Day. My apologies. But some of the more severe ones have not passed. It is very interesting that I only saw these bills before in states like California or New York. Now we're seeing it in Tennessee, Texas. I believe Oklahoma has a bill. I'm seeing these bills emerge in red states, and I'd like to talk more about that when I talk about food safety in future Advocacy Insights. Final one I'm going to highlight, Utah Senate Bill 172. It's going to require the Department of Environmental Quality and each local environmental health department to enter into a cooperative agreement to ensure that environmental health services are provided. This is, again, an example of showing how essential environmental health services are. As I've said before on this podcast, there's not an organic federal environmental health law. We don't have an organic environmental health agency. We get very little of our funding from the federal government. This shows how critical environmental health is to this nation. You cannot have an adequate, robust, or even viable community without environmental health services. Food safety, water safety, sanitation, wastewater, these are critical. The state of Utah is recognizing that, making sure that every county provides these services, that we don't have a situation out there that does not provide. Those of you in public health, you realize there are many programs out there that the only reason they exist because we have federal funding to support it. Environmental health exists because it's absolutely necessary, and that there is and that we cannot survive without it. Final slides here. I want to let you know what we're doing. We are continuing to advocate for the federal environmental health budgets at the National Center for Environmental Health at CDC for FDA Human Foods Program. We are continuing to advocate for public health loan forgiveness to make sure environmental health is included in that. At this point, there's no funding. There hasn't been any funding for this program since the law was passed in 2020. However, we're still going to advocate for it and make sure that environmental health is covered. We continue to support the environmental health workforce, funding for training, funding for activities, funding for preparedness. All these things we are continuing to advocate for. And we are also continuing to support the state, local, tribal, territorial, environmental health agencies and workforce. We are talking to the state legislatures. We are sharing our policies with them. When a food freedom bill pops up, we are there. And when we're able to provide those policy statements, we are also working with the affiliates to make sure those policy statements get out there. And we're going to get more and more proactive on that angle. If you ever want to get a good sense about how to talk to your policymakers or share information with your affiliate about how to talk to policymakers, please download this. I am going to bring some copies to the AEC in Phoenix. If you want to get a copy, look me up. I'm going to be at the booth and the exhibit hall. But if not, go ahead and hit on this QR code. You're going to be able to download a copy or go to our website under advocacy. You'll be able to find Raising the Environmental Health Voice. We also have tell lawmakers to fund the National Center for Environmental Health. If you tap on this QR code, you are going to be able to go to the webpage. It's going to directly link you. All you have to do is fill out your name and address. It'll directly send a message to your congressional delegation. We're going to be able, they'll see right away that their constituents, not the associations, not the national programs, but their individual constituents in their jurisdiction support environmental health. You can craft the language to change it. You can make, you can say different things out there, but this gives you the opportunity to send the message. So far, close to 500 of you have sent messages. Thank you. Big thumbs up. I'd like to make sure we have over 700 by the end of July. Tell lawmakers to fund the FDA Human Foods Program. Another one that's very important. Same deal. You go there, it'll say fund, it'll send a message to your congressional delegation saying we support FDA's Human Foods Program. And we've seen about 500 of you send messages out. We'd like to see that continue. And as always, we've got to advance NEHA. So if you want to know more about what we do for the workforce, take a click here and see if you can, and that'll direct you to our webpage and give you more information. Finally, I really hope to see you in Phoenix next month. It's going to be a great meeting, and we're going to have a great series of speakers, and I'm really looking forward to it. With that, I'm going to stop my share and answer any questions that have come in. Heather, do we see any questions?
I am not seeing any questions.
I am looking under the question and answer section, and it looks like it says, why is chronic disease prevention being eliminated to save money? In order to give money to already wealthy corporations and individuals rather than fund save lives? This is, and I really want folks to take a look at this from the administration's point of view about why they're going to be doing this. They need to find some way to save money. They need to lessen the money, the budgetary burden out there to, as you say, pay for their tax bill. The problem, they've got a fundamental problem though, because they want to also make America healthy. You get rid of the chronic program, you get rid of environmental health, you're not going to have a healthier U.S. You're going to have a sicker U.S. Measles is already expanding in this country. So we do know that health is getting worse. It's not getting better. And as I'm sure you've been tracking the news, even FEMA, which has always had bipartisan support, even there, they're saying we are not looking for budgets beyond the immediate hurricane season, which is a very dangerous place to be. Anybody who has been in state government realizes that when you have a disaster, that's the first thing that first thing people ask you is like, how are you going to respond to it? If they're unable to respond, politicians lose their job pretty quickly. I do have another question here. Who or what agency has the authority to spend of these items funded in the budget bill, and what happens to unspent items? If we look at the current budget bill, this is the thing, I guess, that really shocked me most when I had my conversation with the appropriation staff yesterday, is they actually said, yeah, we're looking at a continuing resolution for fiscal year 26. They're already looking at a continuing resolution for fiscal year 25, which means we are operating on fiscal year 24 numbers. These are programs that are already 2 years old, and nothing in the current budget really reflects the Trump administration's point of view. So it's really very curious about how they're going to meet their objectives if they can't even get the budget passed. Right now, it doesn't look like they're going to get the budget passed. What happened to any unspent money? Well, there you get the discussion on empowerment. Congress has told the administration, you have to spend this dollars for these programs. The administration has come back saying, well, we don't want to fund those programs. And they've been very straightforward about that. Well, legally, the Constitution says they have to fund it. Congress appropriated the money. They said you need to go forward with this. This is the reason we gave you the money. With the next appropriation, we can eliminate the money. But with the current appropriation, we've already told you, you got to spend the money. Now, within broad appropriations, obviously they do have wiggle room. But, much of this is pretty direct. So, with the current fiscal year, since Congress told them in 2024 to give $10 million for the climate and health program at CDC's National Center for Environmental Health, technically, that's what Trump administration should have done. What they did was they eliminated the program. Now it's come back. They still need to really spend the money, technically. If they don't, like the excess money in the IRA, which is what the Biden administration passed a few years ago, which passed Inflation Reduction Act, which provided billions to states to do all sorts of things. Those unspent funds, they got a little bit broader opportunity to redirect them. But technically, they really don't have the ability to not spend them. They may be able to, within parameters, because the bill was so broad, they may be able to move it into different areas, but technically they're supposed to spend it. Unspent budget items, it should continue on. So this is going to be very fascinating to see what we hear. And if anybody else, I'll give you one last chance to see if there's any other questions that you may have. I'll be glad to take them. If not, as you can tell, things are changing dramatically in Washington. We don't know where the budget is going to end up. We don't know even if reconciliation is going to be able to get the Trump agenda through. If the Trump agenda does not go through, we can have expect even more pandemonium. And we could be sitting here working a year from now on budget numbers that were adopted in 2024, meaning a continuing resolution for another year, which would be unprecedented by a long shot. But nevertheless, that is where we stand. As always, I will keep you up to speed. I will keep speaking with you. Next month, I'll be doing the Advocacy Insights from Phoenix at the AEC. Look forward to hoping to see you there.
Doug,
With that,
we actually
yes,
have one
ma'am.
more. We have one more question in the Q&A here.
Okay, I see that. As CDC continues to scale back certain public health recommendations, how does NEHA view the current environment with healthcare providers in terms of safety, preparedness, and support? First of all, as I've said time and time again, it's really up to the state and locals. State and locals provide environmental health service to this country. When CDC scales back, it makes it very difficult to figure out planning for the future because CDC is the one that gets the national data out there, and that's one thing I think they discovered, DOGE discovered pretty quickly, is that we don't know food safety data. We don't know any sort of chemical safety data, which is something that's very important to them. We can't get national data on a variety of things unless CDC has the opportunity and ability to do that. They thought they could do that by just continuing the lab. Unable to. The lab can only do so much. It is the Division of Environmental Health and Scientific Practice that was been able to get out there and get experts on the ground for the East Palestine derailment, for PFAS in waterways, for wildfire smoke in the from wildfires, to respond to hurricanes. Western North Carolina is still in a tough situation after the hurricane, and it's been a year. So we are continuing to advocate for that. I continue to go to Capitol Hill. I continue to send letters to Capitol Hill, and I continue to encourage you all, our members, to get out there and look at this, our advocacy pages, and get those letters out, get the messages to Congress, because you have so much more impact than anyone at NEHA. They want to hear from you. That's what they want to do. Finally, one additional plug, it's a way out, but in March of next year, we'd like to invite everybody to DC to meet with their delegation. We're going to set up a Hill Day for March of next year. Look for it on your calendar. We'll be getting some information out to you in time for the AEC. With that, Heather, we got everybody covered?
It looks like it.
All right. Again, thank you very much. Look forward to seeing everybody in Phoenix. Take care.